Good afternoon. Thank you for being here. Today I'm going to give you some information on the ABCs of heart disease and how your pharmacist can play a role in serving your health needs. I have made each of you a PowerPoint that you can follow along with the information I'm going to give you. I'd like to start off with a quote from the Bible. As each has received a gift, use it to serve one another as good stewards of God's varied grace. A pharmacist serves each patient with medicine, consultation, and tools to assess illness. I will inform you today on the level of care and information your pharmacist can provide if you suffer from cardiovascular disease or if you know someone who does. Do you know the ABCs of preventing heart disease? Did you know that your neighborhood pharmacist can help you prevent heart disease in more ways than your doctor? More people trust their local pharmacist to know more about their health history than their own doctor. As a pharmacy technician for over 15 years, I have seen more and more people relying on their pharmacist for services that can affect their health. For patients with cardiovascular disease, consulting their pharmacist can play a key role in the prevention of coronary events and the optimizing of drug therapy for heart disease. I will give you information on the latest national initiative, the ABCs of preventing heart disease, and finally, the pharmacist's essential role in improving medication use in patients with cardiovascular disease. The Centers of Disease Control, as mentioned in the American Heart Association's 2012 update, the Department of Health and Human Services and Centers for Medicare and Medicaid Services have a goal to prevent 1 million heart attacks and strokes by the year 2017. In the United States, 1 in every 3 people have cardiovascular disease. Women specifically have different risks and issues to consider. The 5 aims of the Million Hearts campaign are: 1, to improve access to effective care. Some people cannot afford a doctor. Everyone is welcome at the pharmacy. To improve the quality of care for the ABCs, which I will explain in just a minute. To focus clinical attention on the prevention of heart attack and stroke. To motivate the public to lead heart-healthy lifestyles. And to improve the prescription and adherence to appropriate medications for the ABCs. This is from the Million Heart Centers for Disease Control. The Journal of American Medical Association lists the ABCs as A is for aspirin therapy. The use of aspirin to prevent a clot from forming in the bloodstream. Aspirin is an antiplatelet. It thins the blood, and it is recommended a dose of 81 milligram aspirin. The risk is that aspirin can cause bleeding elsewhere. You can consult your pharmacist on the warning signs of bleeding or an allergic reaction. On the next slide, you see the chart for the prevention of cardiovascular events. Men ages 45 to 79, women ages 55 to 79. There are people who are older who do have that risk. B is for blood pressure control. 1 in 3 Americans has high blood pressure, with half of these people not having their condition controlled. The pharmacist can help you in the diagnosis, treatment, and prevention of high blood pressure. He already knows the allergies that you have and a list of current medications that are on file. A follow-up appointment with your doctor 4 to 6 weeks later can help determine if any other medication should be added to your regimen. This is from the JNC 7 report of 2005. C is for cholesterol. It is a natural part of your body, and it's affected by risk factors that include age, gender, and family history. You can reduce your cholesterol by consulting your pharmacy about a low-fat diet, exercise plans, and reducing body weight with lifestyle changes. Treatment goals are based on the present risk factors that the patient has and their disease state. The next slide will show you the optimum, borderline, and very high targets for your cholesterol. In conclusion, I would like to say that more people come into a pharmacy with cardiovascular disease than any other disease state. The Million Hearts campaign is based around the ABCs of cardiovascular disease. These areas are specific areas pharmacists focus their efforts on to help improve patient care and decrease heart disease. In closing, I would like to stress the importance of your health and how your pharmacist can be an important part of your healthcare process. Thank you.